But for prepubertal children, they might present in different ways. They might present at school in the gender they were identified were at birth, or they might present as the other gender, or they might be more gender fluid. But you kind of let the child kind of, with counseling and with the family, kind of determine how they present, but there's no medical treatment. So at the start of puberty, so if they fulfill all the criteria with pubertal stage 2, which means you're just starting puberty, and everyone's on board. So the parents are on board, the therapist is on board, the physician's on board, and obviously the patient's on board. Then you can do this protocol. So the protocol, was developed in the Netherlands, has 2 phases. The first phase, at the young adolescent age, is to give what are called a pubertal blocker, to give a medicine to block the progression of puberty, so you don't go through the wrong puberty. And then to continue some counseling. And then somewhere between 14 and 16 years of age, to start slowly cross-gender hormones. Again, they have to go through puberty. Puberty doesn't happen, it's going to take years. So you start low doses, you gradually increase, so that they never go through the wrong puberty. That way, for a transgender woman, male to female, their voice doesn't drop, they don't have hair, they don't have to have electrolysis. For a transgender man, they don't have breast development that will need surgery, they don't have periods, etc. So you block puberty, and then you can, at the appropriate time, send them through the puberty consistent with their gender identity. Does that make sense? Okay.